Want you to know this week is National Public Health Week, and the Erie County Department of Health wants to make sure you are aware of all their many services. Commissioner Dr. Gail Burstein is back, and we're going to be talking about so many things that are on your website that people are free to take advantage of. Good morning.
Right, good morning.
Thank you. All right, let's talk about some of these programs.
Sure. Well, one of our big programs, our largest programs, is our restaurant inspections. So we inspect, thinking of all the restaurants and the food trucks and the festivals that have, food stands. We inspect over 10,000 food services a year.
That's amazing.
It is amazing.
You must have
I
a
can't
big
believe
staff.
it.
I don't think about how big that staff must be to cover all that.
Well, they're busy. They're very, very busy.
Wow.
So they inspect the Taste of Buffalo. I mean, it's just they inspect a lot. And also, if you want to know the results of their inspection, you can go to our Erie County Health Department website, and all the restaurant inspections over the past couple years are listed. So I've actually been surprised myself. Just chicken wing shops or pizza parlors, I would think that wouldn't do that well, they rock. They have no violations, and then some upscale restaurants, I've been surprised, have had some major critical violations. So you never know. So food safety is really important.
Is it just restaurants with prepared food, or is it also places that have raw food?
Well, it's any place that has prepared food. Prepared food. So the raw food, say like grocery smart markets, grocery stores, those are inspected by Ag and Markets. Okay,
so they have their own type of inspection.
Right.
Okay.
Right.
All right. So that's good to know. Good to know. All right.
Right. And then another thing we should think about is public health preparedness. Right.
Oh yes.
Right.
Definitely.
So in case of a disaster, so we actually have an app that it's a free app to download, and you can download it from our Erie County website, and it's it's really a public health preparedness app. It's a we call it Ready app, and you can download it, and then if you get alerts if there are emergencies, say in the winter it's weather, so you get all the weather alerts and access to closings. Also, it helps you walk through creating a preparedness plan, an emergency plan, for your family and for your home. So and it talks about road closures and alternate routes for escape. So it offers a lot. That's great. Also, we have a huge volunteer corps for our public health emergency preparedness called the SMART team. It's called the Specialized Medical Assistance Response Team, and this is really made up of volunteers and not just health professionals. People from the community, because there are a lot of things that people with no particular health background can do to help volunteer. So if you're interested in joining the SMART team, you can look on their Erie County Health Department's website or call the health department and ask about joining. We're always doing drills and exercises to be prepared, and in other places in New York State and the United States have natural disasters with weather like Katrina and Irene and all the other disasters that we've had. Many times we'll deploy a group from Erie County, and we are always receive feedback that we are the most organized preparedness group that they've ever seen. So we really want to be prepared in case of an emergency.
And the website we're talking about is erie.gov/health.
Right.
It's as easy as that. erie.gov/health.com.
Right, or you could also Google it or go to Erie County government's website and find us there.
You see your picture on it, there's the front page.
Yes, ta-da.
And it will direct you to all sorts of places. Now the things that I found, you have the People's Food Movement, opiate training, the Zika virus, how we're on top of that, like you said, the emergency medical services, health insurance information, lead poisoning information, medication and needle disposal. If you're interested on mumps and rabies, STDs, Erie County preparedness, Hope Buffalo. There's a lot of things I had no idea that you're on top of. And it's a fluid website. It changes as the information changes.
Right. If there is something comes up, whether there's a disaster or emergency or just a health fact that people need to know, or we're offering rabies clinics, we put all that information on our website. So we are always checking it every day and making sure that it's up to date.
You know, it's a very, very busy office because, as you know, with disasters happening around us all the time, things change. and you have to react to that. For example, the opiate problem. You've had to get together a task force to combat that because that is at such a crisis level. I mean, you're constantly being aware of what is going on and what we need here in Erie County.
Right. So in addition to trying to be prepared for public health emergencies, we also have to respond.
Yes.
So we've been very aggressive in responding to our opioid crisis.
Yeah. Doc, let me ask you, did you ever, when you first got this job, realize that that so much of this would happen so fast and you really had to really be, like you say, very prepared to move forward at a moment's notice?
Right. Yeah, it was a very steep learning curve for my first 6 months. It was, I really learned, so much about all the rich programs that we have in the county, and also now, being prepared and respond, and I feel like I'm the jack of all trades. I mean, it's every day. It's multiple different subject matters. I can't even imagine what my next job could be. It'd be so boring. It'd be just one subject matter. Yeah, because you're expected to be,
an authority on all of this stuff. But it's amazing, and I'm not surprised that Western New York and Erie County is looked at favorably from other places, because it seems like when there are issues around the country that we don't have here, we're always deploying people who are ready to go, and they're prepared, and they're in service right away. And it's just so nice to know that if we were to need that here, and we do need that here, these folks this is where they're based.
Right. I mean, actually, we've had people contact us from across the country just to understand what our model is to respond to our opioid epidemic, because, they're trying to develop a plan, and we've been seen as really a model program.
Right. How are we doing with that? I know we've got Narcan training, and I know you had a press conference not too long ago. How's all that going?
Well, we are still, rolling out, being aggressive about training people on how to recognize a drug overdose, and then how to use naloxone with a nasal spray. Yeah. We are working with healthcare providers. We're offering buprenorphine training, which is for medication-assisted treatment, so people can get on a, say 1 pill a day, and beat their opioid craving, so they can return to being, employees or students or parents or family members, and return to the community because they won't have that opioid craving.
And all these, if you're interested in that, but no matter really what you're interested in learning or finding, you may find that information on this website as well. They will direct you on what's available around Western New York.
Right. We also, kind of on the other side, we've been working a lot with improving maternal-child health in our community.
Yeah, I love that.
Yeah, so we've really been aggressive about promoting breastfeeding, because, breast is best. So we've been working with community pediatric and OBGYN offices to help them become baby-friendly. And what I mean by baby-friendly is really helping moms with breastfeeding, really promoting breastfeeding, not just, shoving a bottle in in the baby's mouth. Not so fast to do that, but really working with the mom to help her breastfeed. We've been working with over 200 lactation consultants. We've been working with a variety of child care agencies and just even home daycares to really help them become baby friendly and help moms be successful in breastfeeding, because it's best for the baby and it's best for the mom.
I mean, all the natural things that the baby gets from breast milk that you really can't even replicate with formula. And again, it's not always a natural thing. Babies are different, moms are different, and sometimes new mothers really have to be walked through that process. And if it doesn't work out like the first or second time, you don't want people to say, well, okay, we're not doing this. We work with a lactation specialist, and try to get over the hump, so to speak. And then you might find that it was the best thing you could have done while that baby was still an infant.
Right, yeah, it's a skill, and just to have the the counseling and the tips from a lactation consultant can really be a game changer.
Oh yeah.
Can make the difference between having to formula feed and being a successful breastfeeder.
And so again, if you're looking for that information, that's there too on this website. So it's amazing how proactive you are, and it's amazing how many different things that are listed on here, and new things like that, which you're seeing if there's a need in the community, it goes in. So again, busy lady, busy. It's probably stuff on your desk. It's high, because it was amazing when I went back to look and said, you've got this, and that means you've got trained personnel taking care of every one of these things when you actually have to go and use it. And I thought that was very impressive.
Right, yeah, my program staff are really experts in their field. It's very impressive.
So if you have a question, if you would like more information, by all means, keep that website handy, erie.gov/health, okay? You're going to get to this main page, and then you can go off in so many different directions. But the important thing is that you're going to find the information you'll need, all right? And there's plenty of people here who can direct you to find that help. That's what it's there for. Doc, thank you so much for coming in.
Yeah, thank
Love having
you.
Dr. Bernstein
Happy
here.
Public Health Week.
Yes, Public Health, everybody. Go to the website and see what's there for you.